or mobile clinic or hospital, anywhere easy to get it. So please get out and get it, and let's save lives in this community. Thank you.
Good afternoon. Again, as you've heard over the last couple of weeks, Metro Health and the city's leadership have been committed to keeping our residents informed about the status of the pandemic and what we are doing to keep them protected from COVID-19. Right now, our main efforts are doing what we can to get people vaccinated because we see growing evidence that in order to be protected from COVID-19 and the Delta variant, you must be fully vaccinated. Regarding our vaccination efforts, we've been working since February, as we've shared before, with our partners such as community health centers, the faith-based organizations, and businesses to host vaccine pop-up clinics every day in neighborhoods and all throughout the city. The pop-up clinics in particular are helping us to reach as many eligible individuals vaccinated to prevent the spread of the virus in the community, given some of the hesitancy experienced as of late. Excuse me. So as of today, 75% of individuals 12 and older have received at least one vaccine dose, while 62% are fully vaccinated. We also work with schools. So far, we've held over 400 on-site clinics in various school districts. Through these clinics, over 2,800 individuals have now been vaccinated. Again, as you've heard, the looming challenge remains the fact that over 100,000 San Antonians have received their first dose but have not yet received their second dose. We encourage you to get that other dose as soon as possible in order to minimize the likelihood of breakthrough infections. Besides our mobile clinics, our pop-up clinics, right now our focus is to spread the word about getting vaccinated with the support of our partners and our trusted ambassadors on the ground. So our team at Metro Health worked with the city's government and public affairs office to launch What Will It Take campaign. Just a reminder, the first part of the campaign, which included TV spots, digital ads, and awareness on social media, encouraged people to wear masks and practice social distancing. The second part of the campaign focused on encouraging people to get the COVID vaccine. We also worked with GPA to partner with local artists who created murals in communities such as the South Side and East Side that were hardest hit by the pandemic. These murals serve as a reminder to get vaccinated to be protected from the coronavirus. We thank those ambassadors for helping to spread the word by telling the story of the COVID experience through these graphic depictions in area neighborhoods. We continue to run TV spots and digital ads on social media to keep people informed about the pandemic and where they can go to get tested. Again, we have a number of different sites across the city, as well as to receive the COVID vaccine. And as you've heard, again, there is a national campaign. The National Immunization Awareness Month campaign is kicking off. Again, we thank the Centers for Disease Control and Prevention. We are looking at our messaging strategies. We're looking at areas of highest need across the city. We're throwing everything, including the kitchen sink, at this. And if you want more information about this campaign, go to covid19.sanantonio.gov. We also empower our community health workers and other community partners to spread the word and educate residents about COVID-19 and where they can get vaccinated. So again, we ask you to do it for you, do it for your family, and do it for SA. Now I'm going to ask Chief Hood from the Fire Department.
Good afternoon. I come to you from a place of frustration. I sat here 501 days ago talking about COVID when it first started. 71 weeks, it's been a long time. And so we've tested over 730,000 people during that time. We have vaccinated 250,000 San Antonians, whether it was drive-bys at the Dome, where a police officer and a paramedic were both hit. We were there in the cold, the rain, the heat. I saw jubilation on people's faces as they got this vaccine. To think that we still have people out there that are hesitant to get this vaccine is very frustrating, because as we talk about these numbers as far as people in the hospitals, our citizens are still going to be in accidents. They're still going to be injured. They're still going to have heart attacks. That causes us to potentially divert to other locations, and maybe they don't get the standard of care as quick as they could. So, in closing, I ask city employees, get vaccinated if you're not. Ask first responders, police officers, firefighters, get vaccinated if you have not. I just looked at a stat. There have been 50 firefighters around this country that have died from COVID when vaccines were available. Thank God none here. But again, we need you to get vaccinated. We have so many opportunities. So thank you for your opportunity. Thanks for this opportunity to spread this message. Thank you for your time.
Thanks, Chief Hood. My name is Bill Wechter, and I'm representing your hospitals here in San Antonio, the San Antonio area. And I agree with him that it is a frustrating situation we find ourselves in. As noted earlier, we have 418 patients who are currently admitted to area hospitals for COVID. And somewhere between 95 and 97% of all of those patients have one thing in common. That's the fact that they did not get vaccinated. This is a very controllable, and we're not looking at anticipating a surge. We are fully in the middle of another surge. The indicators are all there. The trajectories are all pointing in the same direction. We've admitted over 70 patients today, 70 new patients today in San Antonio area hospitals. We have 121 patients in the ICU, and 50 patients are unfortunately on ventilators across our city. It is preventable, like you've heard from all of these folks in the room. Get out, get your vaccine. Reach out to family members, talk to them, look at the facts that are out there. Don't necessarily listen to all social media, but look at the facts, and we need to take care of ourselves. We are, as a community of hospitals, working together with EMS to make sure that we can expand our bed capacity, but we're also talking about working with nurses who have, as Chief Hood said, for the last 17, 18 months, have had an incredible burden of taking care of a situation here that we've never seen. We need to protect them as well. We need your help, and together we can do that. Get your vaccines. We have plenty of them at the hospitals. We have vaccine literally that is going to expire in the next couple of weeks if we don't use it, and that's a tragedy. Thank you.
Buenas tardes, soy María Villagómez, la subadministradora de la ciudad de San Antonio. Gracias por acompañarnos esta tarde. Queremos compartir con ustedes información acerca del coronavirus aquí en San Antonio. Primeramente, el número de casos aquí en San Antonio es alarmante. Aunque los números son bajos, el número de personas que están en los hospitales ha incrementado a 418 personas. De estas personas que están en el hospital, 97% de estas personas no están vacunadas. La variante Delta que está aquí en San Antonio es mucho más contagiosa y más fuerte que otras variantes. Así que el 83% de los casos aquí en San Antonio son por esta variante. El Departamento de Salud de aquí del condado y de la ciudad de San Antonio está monitoreando constantemente los patrones de transmisión y despliega los recursos necesarios para mitigar la propagación de este virus. Ayúdenos a protegerse a usted y a nuestra comunidad. Por favor, vacúnense. Estar completamente vacunado significa que han pasado 2 semanas de que usted haya recibido las 2 dosis de Moderna o Pfizer y 2 semanas de la vacuna Johnson & Johnson. Nosotros estamos aquí haciendo todo lo posible para que esta vacuna esté disponible a todos los residentes y visitantes de nuestra ciudad. El Departamento de Salud ha patrocinado aproximadamente 300 clínicas móviles de vacunas y estas clínicas siguen en toda la ciudad. Quiero aclarar alguna información que es incorrecta que hemos escuchado en la comunidad. La vacuna no afecta la fertilidad de la persona. Si usted nos da su información cuando se le pone la vacuna, esta información no se le da al Departamento de Migración o ICE. Así que no tengan miedo y por favor pónganse la vacuna. La variante Delta continúa aumentando y ahora representa casi el 80% de los casos en los Estados Unidos. Si tiene usted algunas preguntas o necesita asistencia en español, puede llamar al 311 o visite la página de internet covid19sanantonio.gov. Y recuerde, vacúnese, hágalo por usted, por su familia y por nuestra comunidad. Gracias.
Okay, so here we are. As the chief mentioned, it's been almost a year and a half now As a reminder, there are 3,600 loved ones and neighbors out there who have lost the battle to COVID-19 during the course of this time we've been fighting this pandemic, and we continue to ask them to be remembered, for them to be in your prayers along with their loved ones. And we're here where we wanted to be with the availability of vaccines throughout this entire community. So we were asking for your help and support to get the word out, make sure people know who aren't vaccinated that they have access to them if they're eligible. And also, there are a whole host of young people across this community, those who are not yet eligible, under 12 years old, who are depending on you to do the right thing. So please get out there, get vaccinated, and let's try as best we can as a community to work together to get this pandemic behind us. With that, everyone up here, as well as STRAC Director Epley, Dr. Kurian, Eric Wallace, our city manager, we're all available for questions.
Things as they are right now, Mayor, how important or not important is testing right now?
Let me turn that over to our medical folks to talk a little bit about testing, and I don't know if that's Claude. Dr. Kurian.
Yes, testing,
My question is it still relevant,
yes,
for people to get tested?
yes, it is still relevant. Virus is still circulating in our community. We are seeing on an average about 363 new cases every week. So long as the virus is circulating, so long as we continue to see new cases in our community, this pandemic is still alive and testing is pretty relevant. Yes, it is as relevant as it was when the pandemic began. So if you experience symptoms, regardless of your vaccination status, we recommend you get tested promptly.
What's the status of those testing facilities? Has it been ramped down, for example, community labs that have gone away? What's the status of the city's testing facilities, and will you be boosting those back up again?
So at this time, testing is widely available and accessible in retail pharmacies, doctor's offices. There are a dozen or so free testing sites that are hosted by the city, still ongoing citywide.
So, Dr. Kurian, can you talk about the importance of people over the age of 12 getting vaccinated now, considering we're about a month out from school starting, and many of these children haven't been vaccinated yet?
So as far as we know, all schools are going to be in-person session. That yet remains to be seen, but for the information we have, they are all in-person sessions. And it takes about 2 weeks after your second dose to be fully vaccinated. So it's very important that 12 years and older get vaccinated as soon as possible, not wait for the schools to be in session to get vaccinated.
For any of the hospital administrators up there, are you all considering limiting visitation or delaying elective care to help with staffing and availability?
There have been discussions about visitation. It varies between hospital system, but most of us have had visitation for quite a while, although initially, there was the lack of visitation. It's very difficult in your patients when that happens. So I do foresee, if this continues, that there will be more restrictions put on place, maybe limiting to one patient, family member, for example. But we're trying to coordinate that as a group through and working through STRAC with that.
What prompted today's press conference? The most recent numbers came out 2 days ago. Was there something that changed in the meantime?
Yeah,
specifically?
sure. And I don't think it's anything specific, other than the fact that we hear the information every single day. There is a palpable sense of concern among the public about what this Delta variant means and the rise in cases. And clearly, it's in an effort to express that this pandemic is not over. The virus is still out there. It's not through with us. And I say that with particular emphasis on those who are unvaccinated, because they are taking their lives into their hands, along with those children who can't get vaccinated and everyone else who is immunocompromised. This is not just about the folks who are unvaccinated. It's about the people who are not able to get vaccinated right now, along with those who have conditions that make them more vulnerable. So again, we started this effort 500 plus days ago, reminding everyone that we are in this together, and that still remains true.
Do we have the breakdown of vaccinated versus unvaccinated in the hospital right now? Do we have that breakdown as far as how many people died from COVID who were vaccinated or not?
That may be an Anita question. So yes, we have the vaccinated versus unvaccinated numbers in the hospital today. I don't know if we have vaccinated versus unvaccinated in the fatalities in the hospital or in the community in general. That may be a case investigation question, but I know for sure the hospital numbers of people who are in the hospital right now, it's over 95%. It's over I don't want to bury the lead. The 95% of the people in the hospital today, in the ICU today, are unvaccinated, and we just need to push to get that done.
That's hospitalizations and ICU.
Yeah.
With the vaccine supply that the hospital systems have, that the city has, does anyone have an idea of how much and when vaccine doses are going to expire?
Who wants to answer that one?
It varies.
I think it varies. It varies whenever you've got them. I mean, it's, you know, I don't want to equate it to milk, but think about it that way.
Suffice it to say that there is enough vaccine for folks to get before they expire. Their supply is no longer an issue. It hasn't been an issue for several months now.
Can someone address maybe a concern that some people have where, let's say they've already had COVID, they're unvaccinated, and they believe that they may not need to get the vaccine?
Can you start over?
So let's say somebody already had COVID and they're unvaccinated. Do they still need to get the vaccine?
Yeah, again, thank you. That's a question around the misnomers. So yes, so folks who have been vaccinated and have received COVID, have gotten COVID, this message has been very clear for us to make sure that they continue to at least apply the best care and make sure that they at least can get vaccinated. For us, the reason that that's important and the reason that we're trying to stay on message, when we hear about the number of cases of folks that have been hospitalized, this is a pandemic that's a brush fire that's impacting those who are unvaccinated. So at the end of the day, we want to make sure that we get the word out to folks, and that's why we're at least doing this today. The reason that we're talking about National Immunization Awareness Month is that we do want to address the misnomers, but also amplify the messaging to get this information out to folks.
And for people that have had COVID before, are you seeing any cases of people getting it twice? Like maybe they had it in the beginning of the pandemic and now they're getting it again because they still haven't gotten the shot.
So I'm going to ask Dr. Kieran to at least talk about the patterns of what we're seeing in terms of some of these breakthrough cases.
Yes, we are. We haven't quantified that number, but it is less than one. If you're talking about breakthrough cases, then we are seeing less than 1% of all vaccinated individuals are documenting active infections. Reinfections, we haven't seen that here locally, but that doesn't mean that cannot happen. And that is why we say even if you get COVID, we recommend you get vaccinated because the immunity that's conferred by vaccination lasts longer than your natural infection immunity.
And Dr. K, what's the proportion of, you mentioned less than 1% of the vaccinated population reporting, but when you're looking at the overall cases, what's the breakdown between, you know, breakthrough and unvaccinated?
It's about 30%.
So it's 30?
Among all cases that we have, about 30% are breakthrough infections. But I think the way to look at it is what is the proportion of breakthrough infections among vaccinated individuals?
That's what I mean.
That is less than 1%.
Sorry, I misunderstood. I thought that was 1% of vaccinated people are reporting it. I meant of the cases that are reported, it's 30% are people who have been vaccinated?
Correct.
Does that surprise you that it's so high?
No, because like I said, this pandemic lingers, and now with the variants, Delta variant that is easily transmissible and readily most impacting the younger age group, which has the lowest vaccination coverage. So it's a multitude of these factors that come into play to us seeing these breakthrough infections among vaccinated, because like we've always maintained, vaccination is the best tool we have, but no vaccine is 100% effective. So long as the virus is circulating, so long as we have these variants circulating that can readily impact the unvaccinated, there is always a chance of these breakthrough infections being highly prevalent in the community.
Well, but also keep in mind, Garrett, that 95% of the hospitalizations are people who are unvaccinated. So the vast majority, almost exclusively of the severe cases, are those who have been unvaccinated. So you might come down with a breakthrough infection, but your severity is going to be mild.
And you're not in the hospital. And then Dr. Gay,
I don't have that information, but the national trend is 99% of those fatalities occurred among unvaccinated individuals. We don't believe the trend is any different here locally.
Now, last year in April, kind of officially the outbreak in San Antonio started with the Southeast facility for taking care of the elderly. A year and months after that, now we have another outbreak, 42 people, north side, Harris, San Antonio. Who's keeping tabs on that one, Mayor? Because we know that those places are regulated by the state. How can the residents of San Antonio be sure that somehow that place is going to be contained? Because people were going in and out until news got out that our people are contaminated. So how are you managing this situation?
The health department is working closely with the facilities, and it is the health department's responsibility to make sure we investigate any cases of COVID, regardless of where it occurs here in the community. So we are working closely with the facility. They have stopped all communal events in response to a recommendation. We haven't documented any new cases since the beginning, since this weekend. And I have to let you know, as opposed to the Southeast, the nursing home that you're referring to, where we had more than 80% fatalities, we haven't seen a single fatality here because 99% of the residents have been vaccinated. So overwhelming majority of the cases were mild illness.
Mayor, obviously it's been reported that with the rise of COVID cases, but obviously with the Delta variant, if that continues, would it be a consideration on maybe going back to the mask usage here in the city?
So again, we know that if you are not vaccinated, you should still be wearing a mask. We have, from the start, stayed anchored to the CDC guidance on masking, on testing, on every aspect of this pandemic, and we will continue to. Obviously, if conditions change and the CDC issues new guidance, we will follow. But with regard to mask wearing, mask wearing is advised. If you're in a place with close quarters, whether or not you're vaccinated, if you're a place crowded in there, or if you're uncomfortable, if you have an immune compromised situation, there are certain circumstances where a vaccinated individual should be wearing a mask. But again, it is the recommendation of CDC, which we are adhering to, that if you are not vaccinated, you should be wearing a mask in public at all times.
Dr. Green, I don't know, I just want to double check that figure that you gave us, the 30% of all cases occurring in vaccinated individuals. Does that include partially vaccinated individuals or only the fully vaccinated?
If you look at all the number of cases we have, which is slightly over 230,000 cases, 30% of those were breakthrough infections.
So fully vaccinated, like not a half?
Fully vaccinated, yes.
Have we had problems, has the issue of people only being partially vaccinated exacerbated any of the spread of the coronavirus?
That's very likely. That's very likely.
There's no way to tell for sure?
No way to tell, yes.
Thanks, Sheriff. So 30%, that's of all the cases we've had since the beginning of the pandemic.
Correct.
What about the active cases?
The new cases, of the new cases that have been reported on a weekly basis, approximately 12% are fully vaccinated.
Last one?
All right, thanks everybody.